followed on with as the president. On March 24th, we issued the emergency directive commonly known as Work Safe, Stay Home. On June 8th, as it's done on a monthly basis and has been done on a monthly basis in accordance with legal requirements, the City Council of El Paso adopted an emergency ordinance reenacting the March 17, 2020 emergency ordinance, and through it extended the disaster declaration due to a public health emergency through July 8th. As of June 12th, we had 3,650 confirmed COVID-19 cases and 97, unfortunately, confirmed deaths. We're trying to find this balance between personal and community health and economic recovery. And we're trying to issue directives consistent with the governor's executive orders to help reduce and we hope eventually eliminate COVID-19 infection in our community. We still have restricted activities. People cannot visit, shall not visit nursing homes or state-supported living centers, assisted living centers, or long-term care facilities unless as determined through the guidance from the Texas Health and Human Services Commission. Those are the areas we've also had some spikes, and the judge may want to talk about that specifically. The city has opened our parks, tennis courts, basketball courts, swimming pools, splash pads, a zoo, and in limited capacities. Our museums and public libraries are open in different facilities in different ways. The libraries are primarily on a drive-up basis, and our museums will be opening up in a limited capacity. The governor has said that every business establishment that is non-essential shall now operate at no more than 50%, and that there is no occupancy limitation for the essential businesses that we've had from day one. Now, religious services are now without occupancy limited in churches and congregations and any other houses of worship. But again, I know the judge is going to reiterate this. It's imperative that we continue to wear face coverings, maintain social distancing, and wash our hands. Child care services, there's no occupancy limit on that per the governor. The 50% occupancy limit doesn't apply to outdoor areas, events, or establishments, except with the following areas of professional and college sports and swimming pools and water parks and museums, as I addressed earlier, and zoos and rodeos. The 50% occupancy limit does not apply to the following establishments that occupy with 6 feet of social distancing. We've already talked about them in the past: the cosmetology salons, hair salons, barbershops, massage establishments, and other personal care and beauty services such as tanning salons, tattoo parlors, and piercing studios. Starting at 12:01 a.m. on June 19th, amusement parks and carnivals shall operate at no more than 50% of the normal operating limits as determined by the owner. And for any outdoor gathering estimated to be in excess of 500 people, it's local oversight on that, and the judge may want to talk about that as well. Dine-in services by restaurants that have less than 51% of their gross receipts from the sale of alcoholic beverages are now permitted to operate up to 75% of the total listed occupancy of the restaurant. For indoor bars and similar indoor establishments that are not restaurants, only those customers who are seated may be serviced. Staff members are not included in the determined operating levels except for manufacturing services and outdoor workers. I'm going to let the judge cover flea markets and outdoor stalls and things of that nature in this directive. And that is really it in summation for what has transpired thus far. One of the critical areas that we need in this balancing act that we talk about with the governor and the judge and I talk about is our local economy and trying to get people back to work. And as I've said, and I think that the judge will agree with me, we're not really going to be opening our economy. We may have to be rebuilding it. And the sooner that we can in a safe and non-harmful way, the better off we're going to be. I was looking at our sales tax revenues for the county of El Paso through, it's actually through March as reported in May, and we're down 11% over last year. And we're going to continue to be down. So we need to do all we can, and I want to encourage people who are comfortable in going out to our businesses and our restaurants and those facilities to please do so. But if you're not comfortable, don't do it. So with that, I'll stop and turn it over to Judge Samaniego to fill in the pieces and his own comments. Thank you, Judge.
Thank you very much, Mayor. And I'd like to reiterate what the mayor just said, and that is from the very beginning, we always set abundance of caution. And no matter how going forward, we still have to continue that, to be prudent, to understand our situation, to make sure you adhere to the rules and orders that are being set forth by the mayor, myself, and the governor at all times. One of the things, we get a lot of questions, but one of the things that both the mayor and I always say is if you have social distance, if you wear your mask and wash your hands frequently, you're already way ahead. We're not out of the woods on this one. So if you follow those three, it's not a magic bullet. Things can happen, but if you do those three, then we're going to be very successful. So I would like to reiterate the abundance of caution, and also that we continue with a stay-home order. In other words, that you shall not have groups larger than 10, but that doesn't mean that you can have household to household going in and intermixing between households. And the reason for that is that we identify through the doctors, public health, we identify where are some of our critical points and where are the situations that we really need to address. Our elderly are the ones that have suffered the most, the deaths. We had recently both a mom and the dad of a well-known person here in our community that died. And so that makes it really difficult for us not to address the idea that when you go into a household where you've got people that are above the age of 60, you place them in a very vulnerable situation. And so I just want to make sure that we understand that no more than 10 people means out in public, because those things we can control. We help you with the compliance, and we could give you the orientation and the education. Going from one household to the other obviously is not part of the order. We continue to reinforce that. We also want to make sure, and I think we're doing okay here, and that 65 or older with underlying health conditions should not at any time risk any situation, get someone else to go to the groceries, get someone else to do the things that you need to do because of that, of what I just said. We are continuing, the county side is continuing to keep the parks closed. We're still going to use the trails and the parameters around the park will be open. I have asked Public Works and Parks and Recreation to present a plan that would allow us to feel that we're now ready. I'm sure the city went through that process and they feel that they're ready at this point. We're looking at our situation to make sure that we are ready, that it's a safe place, that it's a place that you could go without having any situation that would increase the virus. We also know that in the bigger parks like Escárate, it brings forth the idea of having social gatherings. So we have done everything possible not to open Escárate Park during holidays, which is, and I'll talk a little bit about, we did the same for Father's Day, Memorial Day, and so forth. And we're looking at the same thing on 4th of July. It's not that we don't want you to go out and have recreation, but it's extremely difficult to control in large parks people gathering and going from one group to the other. So that's our way of, our contribution to making sure that we don't entice or try to get people to come in large groups. One of the ones that's really important is the upcoming elections. It's very difficult when you have something that is so important to our Constitution, to our lives, to our ability to vote. It's very difficult when you have the pandemic. So it hasn't been easy. I want to thank Ms. Weiss of all the things that she's doing. the Democratic Party, the Republican Party working together and trying to, and all the other parties working together to try to make this happen in the best possible way. Early voting will be June the 29th through July the 10th. We have election day on July 14th, so that's coming up pretty quickly. And we are doing everything possible to ensure that you exercise your right to vote and make your vote heard during the pandemic. We have to create safeguards to ensure the health and safety of voters, which include, the election department and all poll workers wearing masks, and they need to pass health screenings. We also have disposable electronic pens, so voters don't have to touch any of the equipment. All workers will remain social distance to the greatest extent possible. One of the things that we're very encouraging, both the judge and I know that, the mayor and I know that if we take the big cluster of individuals who are 65 or older, that takes a lot of that vulnerability that we've been talking about. So if you're 65 years or older or have a disability, we would want you obviously to vote in mail. The voting by mail is going to ensure that we have less people in the voting places and that we have less of this volatile situation that we have with our older population. So we ask you, if there's, of anybody who's 65 or older or has a disability, to make every effort to vote by mail. And that would obviously help us tremendously. And just to remind you that July 2nd is the last day to register to vote by mail. So please keep that in mind. Very important. That would really help us mitigate our situation with our elderly population catching the virus. You can visit www.epcountyvotes.com to get your mail-in ballots and look for voting locations near you. That's going to be very important. Things have changed. Once again, deadline to request mail-in ballots, July the 2nd. Campaign workers will also need to wear masks and maintain social distance requirements with voters. Campaign workers will be prohibited from handing any campaign material directly to voters. All voters are very strongly encouraged to wear masks. 4th of July coming up, amazing challenge. I believe that it might be more of a challenge than Memorial Day. And the reason for that is that we had almost no venues and no events during Memorial Day. With 4th of July coming up, what we do have is self-imposed venues where individuals go out most of the time on Montana Street, and they gather there, and then it makes it really difficult to create the social distance. And so we ask you, if you do go out there, that you do create that social distance and try to avoid. And as the mayor said, we're trying to balance the economy. I know it's an industry. A lot of workers depend on the fireworks. And then I'll talk a little bit about the encouragement that I've had by meeting with the vendors. So we're still monitoring the drought index and may not be able to ban fireworks. The drought index allows me as a county judge to prohibit the fireworks. And if we look at it and we project going forth, it's very unlikely that we'll hit the drought index that is required for us to ban the fireworks. So we met with the local firework vendors, and they're prepared to handle the situation with safeguards in place. Our local health authority will be issuing guidance for them to follow. I'm very, very impressed with the vendors, their commitment. We thought that Chief Esparza and myself were going to have to sort of guide them through the process and make sure they were doing the things that they needed to do. But in essence, they had really worked very hard on creating the guidelines, the markings, and the brochures that they would be handing out, and trying to do everything possible to do curbside pickup of fireworks through the internet. So they're way ahead, very conscientious, and we're always very thankful. I know the mayor and I are always thankful when any industry takes it upon themselves to do the right thing, be prudent, to do the right thing, create a safe environment. And I feel very comfortable that the vendors have done everything possible here and in New Mexico. My hats off to them. It was a very impressive discussion that we had, and all the things that they were doing in order to be able to provide a service, allow you to go out, but then we have to have that social distance. We will have, TxDOT will be marking some places off that might create issues for us. The sheriff and so forth will be there, not an enforcement situation, but to help and educate and get people to be away from the above the 10 or more. On the parade situation, also same kind of restrictions, same kinds of things that we have to do. But what we want you to do is please contact your municipality for their guidance, because you do need to get a license to be able to have the parade. And I think that time frame is coming up very fast. And so we want to thank you for listening to us, and then the mayor, myself, and Dr. Ocaranza. We're very, very interested in coming out in the best situation possible. I've gotten calls and texts and so forth from Travis County that they're wanting to go, step back to the 25%, that they want more restrictions because the numbers are climbing up again. They're having challenges. And as a mayor, and I have always said, it's better to be prudent, do it the right way, do it how the safest possible way, but not have to be detracting, because that's very difficult. You can imagine for a community that now should be at 75, now going back to 25. You can imagine just the emotional impact of going forward and then going backwards. If we do the right things, if you listen to the orders and the comments from the three of us, I think we can move forward properly. But we don't put us in a situation, the mayor and myself, that the numbers keep climbing, or that we see that social distance isn't respected, or that people are not wearing the mask, or that people are deciding that we're out of the woods, and then it puts us in that position then to create orders that become very restrictive. Never conflicting with the governor, but we would petition the governor in case the numbers went up again. And I know the majority of you want to go back to work, want to do the right thing. Same thing for the county and the city. We're trying to do the best to get our employees back, but we're going to be role models. We're going to be prudent, and we're going to do it in the right way. So thank you. And really, it's very important. Let's move swiftly, but in a way that we're cautious and that we are doing the right things at all times. Thank you.
Dr. Ocaranza, do you want to comment?
Yes, good afternoon, and thank you for attending this press conference. Thank you, Judge Samaniego, Mayor Margot. And as we've been giving updates on the cases and hospitalizations and death rates, we have seen that the new cases continue to rise, but at a slower rate. That gives us a very good indication of people listening to the orders, people abiding by the new normal that we're living, and I applaud each and every one of you for following those orders. As Mayor Margot mentioned and Judge Samaniego, the only way that we're going to be able to balance the health and the economy is by each and every one of us taking responsibility in how to control the virus and how to control the spread of this virus, especially to our loved ones. We know that this virus spreads most commonly from person to person, and in smaller proportion from contaminated surfaces. We know that the young people are the ones who's bringing the virus to all their loved ones, especially those that have chronic conditions, and who doesn't have a loved one with chronic conditions. Many of us do. So we need to continue taking care of them. We need to continue being prudent, and we need to continue observing the three main things, which is the social distancing, wearing the face covering, and also practice hygiene by washing hands, not touching your face, covering your cough. And also one thing that is going to be very important now that we're starting to go back to work, that businesses are reopening. If somebody's sick, please stay home, get tested, and follow the recommendations from your physician or healthcare provider. We have a presentation that we're going to be putting in just a little bit. Also in the hospitalizations, here we're seeing how the cases and also the recoveries have been increasing. And unfortunately, the deaths also have been increasing, but it has slowed down on the rate. The next slide, please. On the day-by-day cases, we see some big spikes, and also these big spikes can be attributed to holidays. We already mentioned the Easter holiday. We had already seen the Mother's Day holiday, Memorial Day, and also one very strong recommendation, if anybody participated in the protest, please go get tested. If anybody that was in the protest started feeling symptoms, go get tested as soon as you feel the symptoms. If you don't have any symptoms, you can wait about 5-7 days and go test it. It is very important that also you don't bring the virus to your house or to your loved ones. Next slide, please. The way that we find responsibilities is
Doctor, we're having trouble hearing you.
I guess somebody has a microphone on.
Judge, can you mute yourself? We can hear your background.
Very good. So the way that we're going to be finding those positive cases is by doing extensive testing. We have deployed testing across the city and also across the county, and we've been focusing some of the testing also in congregate facilities like correctional facilities and also those facilities that care for the elderly. We currently are averaging a daily of 147.7 tests per day on CDC week number 23, and currently our positivity rate is at 7.73%. As we see in the graph, the positivity rate has remained fairly stable and is below the 10%. And also that is due to all the people that have been following all the recommendations that we have been given. We know that there's no vaccine yet and there's no specific treatment, so we need to continue observing all those and adapt to the new norm. The next slide, please. On the hospitalizations, we can see that the new hospitalizations, the average per week, has also been decreasing and has been stable, and as well as the new positive cases that have been stable. That is encouraging data, and we need to continue, everybody, to help each other by not, again, exposing our loved ones, especially those that are 65 and older and that have chronic conditions such as diabetes, high blood pressure, because those are the ones that are going to end up in the hospital. Those are going to be the ones having the complications and ultimately passing away. We don't want to have broken homes. And unfortunately, because of all the infection control measures and protocols that the hospitals have in place, there are not going to be any visitors to be there with our loved ones. So it's better to prevent and keep our loved ones healthy. The next slide, please. This slide also shows on the average of positive tests and also on the number of hospitalizations, new hospitalizations that we have in the city. And we see very encouraging that it has been stabilized compared to all the other large cities in the state of Texas that have seen a huge increase in the hospitalizations these past 2 weeks. So we want to continue extraordinary community and emphasizing the importance of, again, wearing your face mask, wearing your face covering when you're outside. If you don't need to be going outside, please stay at home. There's many good things that we can do at home. And if we don't need to be going outside, please just don't do it. Also, as a reminder, many of the positive cases that we have seen is between family members that also go visit each other. And unfortunately, with one person that is positive, is going to infect many others of the same family, extended family. We know that our community is built on love and is built on family values, but at the same time, we need to definitely adapt to the new norm. Next slide, please. Our case fatality rate, which is in the line of orange, it has been stable, even though we've seen that some more residents of El Paso passed away. But hopefully we see that it declines or continue being stable. Next slide, please. The underlying conditions at the time of death, we see that high blood pressure and diabetes are the two most important and the two most prevalent here in El Paso. We know that we're a community built on minority, so we all need to take care of each other. So what do we need to do to make sure that all those that have chronic conditions don't get affected by the virus? Well, we need to definitely take care of them, make sure that they're having the medication to control their chronic conditions. The healthcare facilities are a very good place, and they're following a lot of infection control protocols that will be able to keep everybody safe, seeking help for their acute or chronic conditions. Next slide, please. As mentioned before, the areas that we have been focusing much of our efforts at the present time is on those that have congregate settings such as correctional facilities and facilities that care for the elderly. On the correctional facilities, the state was able to come and test their staff and their inmates, and we found a large proportion of those positive ones in that facility. On the facilities that care for the elderly, they're particularly vulnerable, and testing also was done by the order of the governor, but also we started doing testing before the governor ordered the testing of these facilities. We had deployed the educational task force that started on March 15 and visited approximately 359 facilities and provide education material, support with PPEs, also some other useful information. We gave recommendations to those facilities so they can tighten up and have more strict controls, infection control protocols, so this way they will be protecting the residents. We conducted several return visits at those facilities that needed technical support, and we did a total of 609 visits, so they can be compliant with the local orders. Because of the increase of positive cases in those facilities, a cluster management task force was created and has been able to visit some of those facilities that care for the elder and provide guidance and also much needed recommendations. There was also some more extended testing that had been done, and it will be continued in those facilities that present a problem. We know that the staff is the one that is going to be bringing the virus to those residents that are vulnerable, so we'll be focusing in testing the staff in those facilities. Based on the governor's orders, 17 nursing homes were totally tested based on the mandate from Governor Abbott. And at this point, there were a total of 3,000, a little over 3,000 tests, which about 1,671 were staff and 1,394 were residents. We unfortunately have seen some deaths in those facilities that care for the elderly. So the infection control protocols and stricter measures are going to still be in place. We will continue monitoring those facilities and provide assistance as needed. And with that, again, I would like to thank each and every one of you residents that have followed the orders, because we all need to care for each other, and that's the only way that we will be moving forward, balancing health and the economic of the region. Thank you very much.
Doctor, si lo puede hacer en español, por favor.
Claro que sí. Muy buenas tardes a todo el auditorio. Gracias por sintonizar esta conferencia de prensa que estamos realizando entre el juez Samaniego, el alcalde Margo y su servidor. Queremos informarle a la comunidad que aunque continuamos viendo casos positivos en nuestra comunidad, este número de casos positivos ha disminuido en su velocidad. Esperamos seguir viendo un decremento en la velocidad en la cual vemos casos positivos, y exhortamos a toda la comunidad a que siga todas las reglas y órdenes que se les han dado. Sabemos que no hay vacuna todavía y no hay tratamiento efectivo hasta este momento. Así que lo que tenemos que hacer es cuidarnos unos a otros. Cada individuo tiene que tomar responsabilidad, y si nos cuidamos unos a otros podremos seguir avanzando y podremos seguir realizando nuestras actividades en esta nueva normalidad. Queremos encontrar ese balance entre la economía y salud pública, y solo con la ayuda de cada uno de ustedes lo vamos a lograr. El distanciamiento social, el traer nuestras máscaras y el practicar medidas higiénicas como lavarse las manos frecuentemente, cubrirse la tos o ponerse gel antibacteriano es lo que nos va a ayudar a poder controlar la expansión del virus y poder controlar también nuevos brotes. Hemos visto que la tasa de hospitalización se ha estabilizado, inclusive hemos visto un decremento en estas tasas, lo cual es algo positivo y seguiremos vigilando muy de cerca. La manera en la que vamos a encontrar a todos estos casos positivos es haciendo pruebas a la población en general, y lo hemos realizado estableciendo un programa agresivo de pruebas y estableciendo también lugares para que la gente pueda ir a hacerse la prueba, que sean accesibles para todos aquellos, sobre todo los que tienen dificultad en transportarse. Hemos estado mencionando los lugares en donde se pueden realizar las pruebas, y sobre todo aquellos que puedan estar en riesgo de haber estado expuestos, sobre todo los que participaron en las protestas, son aquellos que pueden tener mucho más riesgo de poder salir infectados de eso. Si usted participó en esas protestas, vaya y hágase la prueba 5 a 7 días después de que participó, o en cualquier momento en cuanto empiece a tener síntomas. También hemos vigilado muy de cerca los brotes que hemos tenido en lugares en donde se concentran las poblaciones o grupos especiales de población, como son las cárceles, y también en aquellos lugares que cuidan de adultos mayores. En esos dos grupos de lugares es donde hemos encontrado la mayor parte de casos positivos en ese tipo de lugares que cuidan de grupos especiales de nuestra población. Hemos desplegado nuestro grupo de educación desde marzo 15, mucho antes de que el gobernador haya dado las órdenes de hacer pruebas a todos estos lugares, y hemos proveído de la educación y de otro tipo de asistencia técnica a muchos de estos lugares. Hemos visitado más de 359 lugares y hemos hecho evaluaciones a más de 75 lugares en los cuales nos pedían ayuda con los equipos de protección personal. Aquí vamos a ver la diapositiva en la cual nos muestra también esos lugares de los brotes. Laura, if you can put the cluster slide. Thank you. Y hemos realizado un total de 609 visitas a estos lugares, en las cuales llevamos las órdenes que se han dado por parte del alcalde y del juez del condado. Llevamos también órdenes que se han dado por parte del Departamento de Salud que se tienen que seguir y que tienen el único objetivo de mantener la salud pública y evitar tragedias. Debido a los casos positivos que hemos encontrado en estos lugares, sobre todo en los que cuidan de adultos mayores, se creó el grupo de manejo de brotes, el cual va y visita estos lugares, hace evaluaciones, recomienda las pruebas que se tienen que hacer y lleva más material educativo para todas aquellas personas que trabajan en esos lugares. El gobernador Abbott ordenó que se hiciera prueba al 100% de los trabajadores y de los residentes de estos lugares que cuidan de adultos mayores, y se hicieron este tipo de pruebas a raíz de la orden del gobernador de un total de 19 lugares que estaban registrados en el estado. Con esto hicimos un total de 3,065 pruebas, de las cuales 1,671 eran de staff y 1,394 eran de los residentes. Desafortunadamente, también hemos visto que en estos lugares que cuidan de adultos mayores, hemos visto muertes, que es algo desafortunado, pero sabemos que esos residentes son los que son más vulnerables. La tasa de mortalidad en El Paso debido al COVID-19 se ha estabilizado y hemos visto que las últimas 2 semanas no ha tenido un incremento y esperamos que permanezca de la misma manera o empecemos a ver que haya un decline de esta tasa. Seguimos pidiendo la ayuda de todos nuestros residentes y sabemos que la gran mayoría ha adoptado esta nueva normalidad en la cual tenemos que ponernos nuestra máscara cuando salgamos, mantener nuestra sana distancia y practicar estos hábitos de higiene que son el lavarnos las manos frecuentemente, el cubrirnos la tos, el no tocarnos la cara, y hacemos énfasis en que si no necesita salir, no salga. Hay muchas otras maneras en las cuales podemos convivir con nuestros seres queridos, pero queremos seguir recordándoles que tenemos que cuidarlos y de la única manera que los vamos a cuidar es manteniendo nuestra distancia y no llevando el virus a esas casas. Hemos visto que desafortunadamente al juntarse varias familias de la familia extensa, por una sola persona que lleva el virus a ese tipo de reunión familiar, se contagian muchas más. Y desafortunadamente, algunos de estos adultos mayores acaban en el hospital. Y por las disposiciones de prevención de infección y otras medidas que necesitamos tener implementadas en los hospitales, no se permiten visitantes. Si nuestros seres queridos acaban enfermos, no los vamos a poder visitar en el hospital y desafortunadamente no vamos a poder estar con ellos. Entonces lo mejor va a ser prevenir la infección y mantenerlos sanos en su casa. Y una vez más les agradecemos el obedecer las órdenes que se les ha dado por parte del juez Samaniego y el alcalde Margo. Y vamos a tener que continuar encontrando ese balance entre la economía y la salud pública, pero solo lo vamos a realizar con la ayuda de cada uno de nosotros y siendo todos responsables de cuidarnos unos a otros. Gracias.
Gracias, doctor. We will now begin with the questions from media. The first question is for you, Dr. O. ¿Qué tan exactas son las cifras de contagio y muertes por COVID en el condado? Se menciona que hubo errores en el conteo y las cifras podrán ser mayor.
Todos los casos que tenemos positivos en la ciudad y el condado, realizamos una evaluación exhaustiva de todos estos casos y en ocasiones puede haber una muy ligera diferencia que no es significativa debido a que Contamos a todos los que son residentes de nuestra área, de nuestro condado del Paso, y tenemos que referir todos aquellos que no tienen su residencia principal en el condado, los referimos a las autoridades correspondientes para que ellos continúen realizando las investigaciones pertinentes. No creemos que esta diferencia sea una mayor barrera en el cual les estamos mostrando a la comunidad la situación actual, y los números que presentamos los actualizamos de manera frecuente para poder continuar mostrándoles todo de una manera muy detallada. And now in English, the question was about the numbers and if there was any difference in the numbers, or the numbers would not reflect an accurate count of the positive cases. And the answer is that we try to have an extremely accurate account of all the positive cases. And after an exhaustive investigation, we need to determine many factors, among others, the primary place of residence, where if the primary place of residence is not in El Paso County, we forward that case to the appropriate health authorities of the primary place of residence. So if there might be a discrepancy, it's going to be extremely small, but we try to correct those as soon as possible. And we publish our information as we have it available, and we do it in a very frequent and timely manner so the people will be informed of the situation of the COVID in our community.
Gracias, doctor. Nos reportan que hay personas que se realizaron las pruebas de COVID hace más de 10 días y aún no han recibido los resultados. ¿Hay algún retraso con los exámenes? And so the question in English is, we have reports that some of the tests for COVID-19 have been delayed by up to 10 days, that they haven't received the test as of yet. Is there a reason for this delay?
La razón por la cual en muchas ocasiones hay un retraso o hay un tiempo un poco prolongado en el cual reciben los resultados de la prueba de laboratorio es porque hay varios laboratorios que están haciendo pruebas y cada laboratorio tiene su tiempo en el cual reporta el resultado. Muchas de las ocasiones también, cuando el Estado hace las pruebas, realiza una llamada por teléfono y si la persona no contesta la llamada porque no reconoce el número, va a haber un retraso bastante grande en el cual puedan recibir el resultado de su laboratorio. Con todas las pruebas que estamos realizando, vamos a seguir teniendo unos días de retraso, pero debe de irse normalizando. Y cuando vaya a realizarse la prueba, pregunte también de qué otra manera puede recibir el resultado. Si es posible accesar el resultado en el internet, en alguna página web, pida la dirección y hágalo de manera oportuna. De esa manera podrá obtener su resultado. La otra recomendación que tenemos es de que si se hizo la prueba porque tenía síntomas o había estado expuesto, permanezca en casa. El hecho de que no le den el resultado en 5 a 7 días no significa que tiene que estar en la calle y poder exponer a otras personas, sobre todo si tienen síntomas, al virus. Porque si en realidad sale positivo, tiene que estar en aislamiento por lo menos 10 a 14 días. Entonces, la mejor recomendación que le tenemos que dar a la población es de que mientras que espera el resultado de su prueba, permanezca en casa. Y ya cuando tenga el resultado, entonces sí ya determina junto con su proveedor médico qué es el mejor curso que necesita tomar. And now in English, about the test, about how to get the result and what is the reason about the lag in test results. And the answer is because the testing goes to different labs. Different labs have different time where they report their results. In some occasions, when the test is performed by the state makes a phone call, and if the people doesn't answer the phone call because they don't recognize the number, the test result is gonna take even longer. One of the recommendations that we have is when you go do the testing, please ask where you can access the result. And if there is a website that you can access, please do it in a timely manner. And in that way, you will be having the result. very important recommendation for everybody that went to do testing. If you went to get the test done because you had symptoms, please remain at home. Even if you're waiting for the result, doesn't mean that you can go out and do other activities, because you're going to be exposing other people, especially your loved ones, if indeed you are positive. So if you're waiting for the result, please remain at home. And if you're positive, then you're going to need to remain in isolation for at least 10 to 14 days. So please check your results and ask where you can access those results.
Thank you, Doctor. The next question is for Mayor and for the county judge. The question is as follows. Does the city and county plan to seek further reopening exemptions? And I'll start with the mayor, if I may, and ask the judge to follow up.
Well, based on what Dr. Ocarranza just shared with you and the data we have, we seem to be plateauing. I don't think we've hit the top. I don't think we've hit the peak necessarily, but we seem to be plateauing, and the real the data that we need to know about is the hospitalizations and the ICU and the ventilators. Right now we have plenty of capacity for that. So I would hope that we don't have to restrict our economy any more than we have in the past, and as we continue to move forward with the governor's orders. But so far, I think in spite of other areas, I think Dallas and some others have had, and Austin have some big spikes, we haven't had that yet, and we hope we don't. So based on the data that Dr. Ocarranza just shared, I think we're hanging in there for the time being. And remember, we're all going to have to learn how to live with this until we have a vaccine, and that's the bottom line. Judge? You're still muted.
There you go. Yeah, as I said earlier, that the mayor and I would obviously take into consideration if there was a peak, and then we would decide what we would need to do to be more restrictive that aligns with our problem. You know, we're very conscientious of the numbers, and if we saw a peak, we would get together, the mayor and I, and then decide what is it that we need, because it might be an area in particular. I know that in some areas they've asked for the bars not to be open yet because they felt that was harder to maintain. So just depending, and I said, and I'll reinforce and reiterate again and again, and that is if we do the right things, and then we won't be in that situation. If we do the social gatherings and we get problems, and obviously then that puts the mayor and I back on this idea of asking for exemptions. And we wouldn't like that, because we know, and we said, sometimes we don't know which is the worst ill, because we have the public health side, but the economy, if not done properly, it could take a toll. People not working, not having insurance, people that don't have access to medical situations. And so we have to balance those two. So yeah, we would look at it on a case by case, and depending the peak, and then deciding if there was a cluster or an area of importance that the mayor and I would address.
Judge, would you be so kind to speak to it in Spanish?
Sí. La pregunta era que si vamos a tratar de buscar una exención si suben los números, que si vamos a hacer una petición al gobernador para pedirle que o se vaya más lento en abrir los negocios, o retrasarnos un poco y no abrir los negocios. Y lo que les digo es de que si hacemos las cosas que tenemos que hacer, si seguimos las órdenes, no nos ponen a nosotros, al alcalde y a mí, en una posición de tener que hacer más restricciones. Esas restricciones van a venir si vemos que hubo un pico o hubo una situación difícil. Si nosotros vemos que es una área en particular que nos va a afectar, Entonces vamos a tener una plática el alcalde y yo para ver qué es lo que podemos hacer. En muchas áreas abrieron los bares y no les funcionó, están teniendo problemas y están pidiendo que ya no se abran los bares. En Juárez, el alcalde dijo que iba a ser lo último que iba a hacer él, es abrir los bares. Entonces, si vemos que vamos bien, continuamos. Si vemos que no está funcionando la orden tal como la estamos poniendo o estamos utilizando en este momento el alcalde y yo, pues vamos a tener que decidir qué es lo que podemos hacer. No podemos permitir que más gente muera y nosotros no intervenir y hacer algo más restrictivo.
Gracias. The next question is, I'm going to ask Carlin Neiman to speak to the next question, and also Enrique Dueñas, if you could provide the translation. The question is, can you clarify local eviction rules? Good afternoon, Ms. Neiman.
Good afternoon. Can you hear me?
Yes, ma'am.
The current requirements under the law are as follows. Locally, our Justice of the Peace issued an order that stated that evictions will not be heard until June 22nd unless the hearing was previously scheduled prior to the issuance of the order. That order was issued on May 29th, so if a landlord had requested a hearing prior to that time, they would be heard. Also, no evictions will be heard or issued before June 15th, unless, of course, they had been requested prior to the May 29th order that was issued. The City of El Paso has also issued through the mayor and council an emergency ordinance that prohibits evictions and encourages landlords and tenants to continue to work together on a payment plan or deferred rent payments until the situation improves. Obviously, the city has the authority based on a case-by-case basis to issue citations to a landlord if it feels that there was not a good faith effort on behalf of the landlord and the tenant to avoid the eviction. Does that answer the question, Laura?
Yes, ma'am. Thank you. I'm going to ask Enrique to provide a translation for us.
Sí, lo que se estaba comentando era que no habrá audiencias de desalojos hasta el día de junio 22. En el caso de las órdenes de desalojo como tal, a menos que hayan sido emitidas previamente, antes de que las órdenes de los jueces fueran emitidas, no habrá ningún tipo de desalojo hasta junio 15.
Gracias, Enrique. The next question, now that some recreational or sports leagues have started practicing, what are some of the best practices teams should follow, and what steps should teams take should a player present symptoms? And I believe this question is for Dr. O.
Yes, now that the sports leagues are going to be starting to open slowly, one of the best recommendations that we have is that if the athlete is sick, don't take him to go practice. Everybody is going to need to be wearing their face mask and take it off when they're going to be doing their practice. There's going to be ways that they can do also practice social distancing in the way that they're going to be doing their sports and some other activities, especially outdoors. So, and also carry with you some hand sanitizer and use it after the practice. And as soon as you're done with that practice, go home. You can wash your hands or take a shower. Hygiene, social distancing, and facial covering is going to take us long ways. Y ahora en español, la pregunta era de qué son las mejores recomendaciones que se pueden dar ahora que van a empezar las prácticas con los deportes. Y la mejor recomendación que les tenemos que hacer es, una, que si el deportista o la persona que va a ir a entrenar se siente enferma, que no vaya. La otra es de que si van a salir de su casa, pónganse su máscara y ya cuando vayan a empezar a hacer el ejercicio se la quitan. También hay maneras de cómo practicar la sana distancia, incluyendo cuando están haciendo ciertos deportes. Y carguen con usted un gel para las manos antibacteriano, el cual lo pueden usar cuando acaben y también cuando lleguen a la casa, lávense las manos o si prefieren, métanse a bañar. La higiene, el practicar la sana distancia y el ponerse la máscara cuando salgan en público son los 3 elementos que nos van a llevar al éxito y a disminuir la transmisión del virus.
Gracias, doctor. The 2 remaining questions, the first question of the end is, what is the difference between hanging out with 10 at home versus in the public realm? And Doctor or Mayor, if you wish to.
Yeah, you want me to take that one, Mayor? Or?
Either or, yeah, go ahead, Judge.
No, I was just going to say that, remember I said earlier that we're focusing where there's an issue, and the issue has been in the household of people going out and coming back into the household. So if you know who lives there and you're able to control that situation, then you're less vulnerable. When you go from one household to the other or have 10 people, then you don't know where the contact has been, you know, what relationship they've had in the community and so forth. And so we know at public, you're given that opportunity to have the distance, you're able to wear the mask, you're able to, you know, do all the things that we're asking. In the household, it becomes extremely difficult. And I know people talk about, well, we have it outside the yard. You still have to go inside the home. You're going to run into somebody that maybe is over the age of 60, 65, that might be vulnerable. So we believe that to address the vulnerability of the older population, it's going to be there in the household. So in the venue, when you're outside and then you can distance yourself, you can do a lot of different things. You're aware of each other's interactions, and you don't know, you can stay away from people that you need to stay away because you believe that there's 10 other groups and you want to stay away from them. So I think the management itself, and then plus remember that it's a stay at home. So if it's stay at home, that means you're able to go out to the essential businesses, the businesses that have opened, the occupancies, we could do all of that, but we've always said go out and then come back home. You know, just come back home. But if you go from household to household, that's where we have the vulnerability. So it's a difficult situation, but we're trying our best to avoid an issue that we know is very dear to us and very sad, of individuals dying because that virus is brought back into the household.
The biggest thing, I think, echoing what the judge said, is the perception across the nation has been that people are, because of the warm weather and the loosening of restrictions, are letting their guards down. And that's the main thing. And we have a propensity within our homes to be the least guarded related to face coverings and distancing and washing our hands. And so I think that's the big issue, I think. But the only thing we're certain of, everything keeps changing almost on a daily basis, but the only thing we're certain of, and I think Dr. Carranza will confirm, is that we do know that if you wear face coverings, if you maintain social distancing, and if you wash your hands frequently, you're less likely to have any kind of spread whatsoever.
Thank you, gentlemen. Just to build on the question. Doctor, can you mute yourself?
The same question?
Go ahead.
Yes, I want to concur with Mayor Margo and Judge Samaniego that gathering, even though it's going to be the extended family, with only one person that has the virus, is going to spread it to all the extended family. So what we need to use is common sense. That's the best also tool that we have. Using common sense in what we do, the activities that we carry out. If we're going to be out in the family, and we want to go to the park and enjoy the outdoors, we will. And Mayor Margot mentioned it really well, that when we're among family members, we relax the social distancing. We don't wear the face covering. We don't wash our hands. We share many things, and that's the way that we're going to be infecting each other. So we cannot let our guard down. Please continue observing all these elements that are part of the new norm, and we will continue moving forward. And as we adapt to the new norm, there will be continuous changes, and we will adapt. And that's the most important thing.
And you all had already pretty much answered this question, but just to make sure that I'm asking the question, does this no more than 10 at somebody's house, would it apply to somebody's backyard or their garage? I'm assuming the answer would be yes, if you all could elaborate on that just to close that out.
Well, again, there's really no limitation according to the orders and the directives related to outside. The issue is, as the judge has talked about it, Dr. We have a propensity at our homes to let our guards down. We just would encourage people to continue to maintain that level. I mean, it's going to be awfully hard. It seems like the spread that we have, and Dr. Ocarranza can confirm this, seems to come out of family gatherings as much or more than any other situation, with the exception of nursing homes and some things like that. But no, there's not a limitation within our directive related to that. We are encouraging that you maintain limitations and wear face coverings and have social distancing and wash your hands. That's the main thing. But no, if you go by the strict letter of the directive, outdoor activity has no limitation as to numbers. But we want to encourage you. And again, as the judge said, if we have spikes, it will affect what we're doing for the future. And we want to open our economy as fast as we can, given the fact that we know that the financial impact is almost as great, if not greater at this point, than the physical impact.
And if I could ask either Judge or Dr. O if they could give a very brief Spanish response.
On that particular question, or just in general?
Yes, sir. On that particular question, on that, the thought process of hanging out with 10 at home or in the public, and how it applies to the backyard garage.
Si es que sabemos que la idea de no tener a las personas de un hogar irse a otro hogar es porque estamos tratando de ver el problema, que es muy triste que tantas personas han muerto. Y sabemos que gente de 60, 65 no son los más posibles que anden afuera. Entonces sabemos que ese virus puede venir de afuera a un hogar. Entonces sabemos que es muy difícil mantener la distancia. Tenemos la propensidad de que no vamos a hacer las cosas que hiciéramos. Cuando ustedes están afuera en un lugar, pueden controlar la distancia, pueden controlar con quién están, pueden hacer hay muchos factores muy diferentes a estar en el hogar. Si dicen que están afuera, van a entrar a la casa, y entrando a la casa va a haber ciertas situaciones, contactos que no van a tener si están en público. Entonces, como dice el alcalde, si lo pudiéramos verlo, que si afuera no más de 10 personas, pero sabemos que va a ser muy difícil. Estar prudentes y estar conscientes de que tenemos un problema muy grave en gente que está muriendo de la edad mayor de 60. Eso es nuestra manera de evitar un problema. Como les digo, cuando nosotros vemos un problema, tenemos que ejercer la orden y dirigirla a ese problema. Y sentimos muy fuerte que manteniéndose en los hogares y no irse de un hogar al otro va a ser una de las maneras que vamos a parar el virus y hacer algo muy efectivo para que no continúe. Es un área muy importante para todos.
Thank you, gentlemen. I'll leave it open if you all wanted to close it out. Otherwise, this ends our press conference for today. We thank everybody who joined us this afternoon, and have a blessed weekend.
Thank you.